Good afternoon. This is All India Radio. I am Valsa Williams and with me is Anuja Kumar with the Midday News. The headlines. Prime Minister Narendra Modi says today's startups are the multinational companies of tomorrow. Health Minister Harshvardhan says COVID-19 vaccine will be given free across the country. Nationwide dry run for COVID-19 vaccination underway. National COVID-19 recovery rate improves to 96.12%. And Centre extends disability compensation to all serving employees if they get disabled in line of duty. As the nation fights the COVID-19 pandemic, we begin with a message of precaution to stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. Prime Minister Narendra Modi has said that today's startups are the multinational companies of tomorrow.
बीते दशकों में एक ट्रेंड देश ने देखा, बाहर बने मल्टीनेशनल बड़ी संख्या में आए और इसी धरती पर आगे भी बढ़े। ये दशक और ये सदी भारत में नए नए मल्टीनेशनल के निर्माण का है। भारत का सामर्थ्य दुनिया में छा जाए, इसके लिए ये उत्तम कालखंड आया है। आज के स्टार्टअप्स ही कल के मल्टीनेशनल्स हैं।
He was laying the foundation stone for the permanent campus of IIM Sambalpur, Odisha via video conferencing today. Addressing the event, the Prime Minister said the real task of the management is not just to manage the institutions but also to improve the lives of people. Stating that management is based on the broader concepts of innovation, integrity and inclusiveness, the Prime Minister said those who are left behind in the race for development must also be included in the journey towards growth. The Prime Minister said the vast talent pool of the IIMs both within and outside the country can help realize the goals of globalizing Brand India. He said the management experts can also play a vital role in making the local go global in the overall framework of an Atmanirbhar Bharat.
लोकल को ग्लोबल बनाने के लिए आप सभी आईआईएम के युवा साथियों को नए और इनोवेटिव समाधान तलाशने हैं। मुझे विश्वास है हमारे आईआईएम्स आत्मनिर्भरता के देश के मिशन में स्थानीय उत्पादों और अंतर्राष्ट्रीय कोलैबोरेशन के बीच ब्रिज का काम कर सकते हैं। साल 2014 तक हमारे यहाँ 13 आईआईएम थे, अब देश में 20 आईआईएम है। इतना बड़ा टैलेंट पूल आत्मनिर्भर भारत अभियान को बहुत विस्तार दे सकता है। आज दुनिया में अपॉर्चुनिटीज भी नहीं है तो मैनेजमेंट की दुनिया के सामने चैलेंजेस भी नए हैं।
PM Modi said from the farming sector to the space sector, the scope for startups is increasing and most startups are coming up in Tier 2 and 3 cities of the country. The permanent campus of IIM Sambalpur will represent the great heritage of Odisha, the Prime Minister stated.
IIM कैंपस के शिलान्यास के साथ ही ओडिशा के युवा सामर्थ्य को मजबूती देने वाली एक नवीन शिला भी रखी गई। IIM संबलपुर का परमानेंट कैंपस ओडिशा की महान संस्कृति और संसाधनों की पहचान के साथ ओडिशा को मैनेजमेंट की दुनिया में नई पहचान दिलाने वाला है।
He said the startups need effective managers who in turn need to not just run with the time but also ahead of the time to catapult Brand India onto the global stage.
हमारी कोशिश है कि हम ना सिर्फ समय के साथ चलें बल्कि समय के पहले चलने की भी कोशिश करें। जैसे काम के तरीके बदल रहे हैं वैसे ही मैनेजमेंट स्किल्स की डिमांड भी बदल रही है। अब टॉप डाउन या टॉप हैवी मैनेजमेंट के बजाय कोलैबोरेटिव, इनोवेटिव और ट्रांसफॉर्मेटिव मैनेजमेंट का समय है। ये कोलैबोरेशन साथियों के साथ जरूरी है ही, बॉट्स और एल्गोरिथम्स भी अब टीम मेंबर्स के रूप में आपके साथ है। इसलिए आज जितना ह्यूमन मैनेजमेंट जरूरी है उतना ही टेक्नोलॉजिकल मैनेजमेंट भी आवश्यक है।
PM Modi emphasized that despite the COVID-19 pandemic, India has witnessed more number of unicorns in 2020. The youth have a huge responsibility towards brand India, he added. Till 2014, there were 13 IIMs in India. Today, there are 20 IIMs. Such a large talent pool can help strengthen the Atmanirbhar Bharat campaign.
कोविड संकट के बावजूद भारत ने पिछले सालों की तुलना में ज्यादा यूनिकॉर्न दिए हैं। आज खेती से लेकर स्पेस सेक्टर तक जो अभूतपूर्व रिफॉर्म्स किए जा रहे हैं, उनमें स्टार्टअप्स के लिए स्कोप लगातार बढ़ रहा है। आपको इन नई संभावनाओं के लिए खुद को तैयार करना है। आपको अपने कैरियर को भारत की आशाओं और आकांक्षाओं के साथ जोड़ना है। इस नए दशक में ब्रांड इंडिया को नई ग्लोबल पहचान दिलाने की जिम्मेदारी हम सब पर है, विशेष रूप से हमारे नौजवानों पर है।
Extending his New Year greetings to the people of Odisha in the vernacular, the Prime Minister spoke at length on the rich repository of mineral and forest resources of Odisha, arts, culture, literature and handicrafts of Sambalpur region and said IIM Sambalpur will give a new identity to the state. He said the establishment of higher educational institutions like the IIMs in relatively smaller cities gives a big boost to the broadening and deepening of the startup ecosystem in the country.
Speaking on the occasion, Chief Minister Naveen Patnaik said IIM Sambalpur, which was set up in 2015, has already proved its mettle. He said he is delighted that the Prime Minister is laying the foundation stone for infrastructural development of IIM Sambalpur.
Set up in 2015, IIM Sambalpur has already proved its mettle as one of the premier management institutions of the country. In just about 5 years, it has been able to cast its positive impact upon the hierarchy of educational institutions in Odisha.
IIM Sambalpur is the first IIM to implement the idea of the flipped classroom, where the basic concepts are learnt in digital mode and experiential learning takes place in the class through live projects from the industry. The institute has also outscored all other IIMs in terms of the highest gender diversity, with 49% girl students in MBA 2019-21 batch and 43% in MBA 2020-22 batch. Odisha Governor Professor Ganeshi Lal, Union Education Minister Ramesh Pokhriyal Nishank, Union Ministers Dharmendra Pradhan and Pratap Chandra Sarangi were present on the occasion. The ceremony was virtually attended by over 5,000 invitees, including officials, industry leaders, academicians and students, alumni and faculty of IIM Sambalpur.
Health Minister Dr. Harshvardhan today said the COVID-19 vaccine will be free across India. Talking to media, Dr. Harshvardhan said not just in Delhi but across the country, the vaccine will be provided free of cost. The Health Minister was visiting hospitals in Delhi to review the dry run drill for administering COVID-19 vaccine. He appealed to the people not to be misguided by rumours regarding safety and efficacy of the vaccine. He said the government will not compromise on any protocol before approving a vaccine. The minister pointed out that vaccine hesitancy was an issue even at the start of polio immunization drive, but the polio inoculation turned out to be a huge success, saving mankind. He said guidelines for today's nationwide dry run have been updated based on the feedback from the insightful pilot dry run held in 4 states. He added that except for giving actual vaccine, every procedure is being followed during the drill.
भारत की सरकार सारे देश के लोगों को कोविड से हर प्रकार की प्रक्रिया के माध्यम से सुरक्षित रखना चाहती है। वैक्सीन का डेवलपमेंट भी उसी प्रक्रिया में से एक प्रक्रिया है। सबसे प्राइम हम लोगों का क्राइटेरिया अगर है तो वैक्सीन के ट्रायल्स में वो सेफ्टी है, एफिकेसी है, उसकी इम्यूनोजेनिसिटी है और इनमें से किसी भी चीज के ऊपर कोई कॉम्प्रोमाइज नहीं है।
The minister added that around 2,000 master trainers have been prepared for the vaccination. He said health workers have also been trained in all states and union territories for administration of the vaccine.
A nationwide dry run for COVID-19 vaccination will be conducted today. Dry run is essentially a practice session where a sample number of beneficiaries will go through a mock immunization process. The exercise is aimed at testing the preparedness for the vaccine rollout. Today's dry run will be conducted across all states and union territories. Each state and union territory has been asked to conduct the dry run at minimum 3 session sites. Apart from the staff of the designated vaccination centers, the dry run will see the participation of a select group of healthcare workers as test vaccine beneficiaries. Each center will identify 25 test beneficiaries for the dry run. The mock drill will ensure that phase 1 of COVID-19 vaccination goes without any glitch. Health Minister Harshvardhan chaired a high-level meeting yesterday to review the preparedness for the dry run. In Bihar, dry run of COVID-19 vaccine is being undertaken successfully in 3 districts of the state. 3 towns of Patna, Jamui and Bettiah have been selected for the dry run of the vaccine. In Patna, Health Minister Mangal Pandey inspected the dry run at Fulbari Sharif Subdivisional Office and Shastri Nagar Primary Health Centre and Danapur Subdivisional Hospital. Mr. Pandey said this dry run will be very helpful during the implementation of the real vaccination program. He said it will provide practical knowledge to all those involved in this process, and they will also help us to know if we have to change any procedure. Meanwhile, COVID-19 recovery rate has improved to 97.57% in Bihar. The number of active cases in the state is continuously declining. Currently, 4,765 patients are undergoing treatment at various hospitals. 2,47,089 patients have so far recovered from the infection in the state.
The Uttar Pradesh government is conducting a dry run of COVID vaccinations today at 6 places in the state capital, Lucknow. More from our Lucknow correspondent.
Dry run of COVID vaccination is being conducted at 6 centers in Lucknow, including Sahara Hospital, RML Hospital, King George Medical University and SGPGI. At King George Medical University in Lucknow, it started around 11 a.m. in morning. Nishant Verma, nodal officer of COVID-19, said that department has prepared to inoculate around 50 people today. During this process, there will be 3 areas: vaccination area, observation area and waiting area. Additional Chief Secretary Health of State Amit Mohan Prasad has informed that dry run of COVID vaccination will be done in the entire state from January 5th. He said that government is making all arrangements for the vaccination, which includes expansion of COVID chain storage and installation of CCTV cameras at vaccination centers and places of vaccine storage. Sushil Chandra Tiwari, AIR News, Lucknow.
In Madhya Pradesh, COVID vaccine dry run was conducted at the vaccination centers set up at 3 hospitals in Bhopal today as part of the countrywide dry run to finalize preparations for COVID-19 vaccination. More from our Bhopal correspondent.
State Immunization Officer Dr. Santosh Shukla informed that the dry run was conducted successfully at 3 centers, which includes Gandhinagar Health Center, Allen Medical College Kolar and Govindpura Health Center from 9 a.m. to 11 a.m. 25 health workers at each vaccination center and team of 5 vaccine officers conducted the dry run at each of 3 centers. Medical Education Minister of State Vishwas Sarang along with District Collector Avinash Lavanya monitored the process of dry run. Medical Education Minister Shri Sarang informed that trial run was conducted smoothly and state is prepared for vaccination drive as per prescribed protocol. Pooja Pivardhan, AIR News, Bhopal.
In Telangana state, the dry run has begun smoothly in Hyderabad and Mehboob-Nagar districts as part of the nationwide exercise for assessing the preparedness of the state health departments. A total of 6 centers have been identified for the same by the central health authorities. More from our correspondent.
The dry run taken up for assessing the preparedness of state health departments is underway in Telangana state. Each center has picked up 25 people. Most of them are health workers from the lists uploaded on the COVID Vaccine Intelligence Network app for the exercise. Out of the 6 centers chosen for the dry run in the state, 3 are in Hyderabad. They include Nampalli Area Hospital, Tilaknagar Urban Primary Health Center and a private corporate hospital in Somaziguda. Similarly, in Mehboob-Nagar district, 3 more centers including Government General Hospital, a primary health center and a private hospital have been chosen. According to the state public health authorities, the vaccination activities have been demonstrated as part of the dry run. The health workers have been trained in matters relating to maintaining temperatures of vaccines and storage conditions. They are also being trained in shifting vaccines from storage points to vaccination centers. Lakshmi, AIR News, Hyderabad.
In Tamil Nadu, the first stage of the dry run began at 17 places today. More than 5 lakh healthcare workers are involved in the campaign. Apart from Chennai, the exercise is being carried out in Nilgiris, Tirunelveli, Coimbatore and Tiruvallur districts. Our correspondent has filed this report.
The first stage of the dry run exercise for COVID vaccine in Tamil Nadu began at 17 places today. More than 5 lakh healthcare workers are involved in the campaign. Apart from Chennai, the exercise is carried out in Nilgiris, Tirunelveli and Coimbatore district. The health department officials and the district administration staff check the multiple steps to be completed like identification of the individual, vaccination process, arrangements for the internet connectivity, facilities in the observation room and efficiency of the exclusive vaccination network. On completion of the process, the public health department will send text messages to the individuals after registering at the CoWIN app. As promised, the state government will administer the vaccine to all the individuals in the state in different phases. Joy, AR News from Chennai.
In Maharashtra, dry run for the vaccination program is being conducted at 4 districts in the state at Pune, Nagpur, Jalna and Nandurbar. More from our Mumbai correspondent.
All the 4 districts have 3 vaccination centers, each having 25 people as beneficiaries for the mock vaccination drill. Maharashtra Health Minister Rajesh Tope said vaccines will not be administered to anyone, but all operation preparedness will be tested by this dry run, including manpower management at the centers, protocol following, unhindered power and internet supply, etc. He further informed that each center will have a waiting room, a vaccination room and an observation room. Devapriya Bhattacharjee, AIR News, Mumbai.
Gujarat is undertaking the dry run in 4 more districts today. Dry run exercise will be conducted in Dahod, Bhavnagar, Valsad and Anand districts along with the national dry run. More from our Ahmedabad correspondent.
First dry run for COVID-19 vaccination program was carried out in Gandhinagar and Rajkot districts last week. Administrative measures and actual fieldwork related to vaccination were covered during that 2-day dry run. No major issue was found during the dry run conducted in Gandhinagar and Rajkot districts. Now the same exercise is being carried out by Zydus Medical College in Dahod, Sir T. General Hospital in Bhavnagar, GMERS Medical College in Valsad and District Hospital in Anand. It will also cover 1 urban health center and 1 outreach center outside the urban area in each district. Yogesh Pandya, AIR News, Ahmedabad.
In Andaman and Nicobar Islands, dry run for COVID-19 vaccination is being conducted today at 2 sites in Port Blair. About 50 volunteers participated in today's mock drill. GB Pant Hospital and Ayush Hospital have been selected for the dry run. Proper arrangements have been made by the Directorate of Health Services to conduct this activity. The whole process is done in a very delicate manner as per the protocol. Prior to this, the Health Secretary, D. Kandavelu, along with other higher officials, inspected the site and the process initiated in their presence. Dr. Omkar Singh, Director Health Services, stated that the objective of this run is to get ready for the actual vaccination and figure out the possible hurdles coming in its implementation. You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi says today's startups are the multinational companies of tomorrow. Health Minister Harshvardhan says COVID-19 vaccine will be given free across the country. Nationwide dry run for COVID-19 vaccination underway. National COVID-19 recovery rate improves to 96.12%. And Centre extends disability compensation to all serving employees if they get disabled in line of duty. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts. चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो खुद से वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back to the Midday News. India crossed yet another significant milestone in its fight against COVID as the active caseload in the country today has further decreased to stand at 2.43%. With continuous decline in the number of active corona cases, the active cases in the country witnessed a decline of nearly 4,000 cases in the past 24 hours to stand at around 2,50,000. The number of new daily cases remained below 20,000, with nearly 19,000 fresh cases being reported in the last 24 hours. The national cumulative recovery rate has also further improved to 96.12%, with a recovery of over 99 lakh people so far. With recovery of over 22,900 people in the last 24 hours, the number of daily recoveries continue to outnumber the new daily cases. The total recovered cases in the country today stands at nearly 40 times the number of active cases.
Delhi reported 585 new cases of COVID-19 in the past 24 hours, taking the total count to 6,25,954. The Metro Police reported 717 recoveries and 21 deaths yesterday. Total recoveries in the national capital are 6,10,039. The death toll has gone up to 10,557, while the city has 5,358 active cases. The cumulative positivity rate is 7.16%, while the case-death rate is 1.69%. In Mizoram, with the recovery of 4,100 COVID-19 patients, the recovery rate has improved to 97.25%. The total number of active cases in the state has come down to 111. According to the State Medical Bulletin, 3 new cases were recorded and 2 patients recovered from the infection in the past 24 hours. With this, the COVID-19 tally has reached 4,219 in the state.
The centre has decided to extend disability compensation to all serving employees if they get disabled in the line of duty while performing their service and are retained in service in spite of such disablement. This was announced by Minister of State for Personnel, Public Grievances and Pensions, Jitendra Singh, yesterday. He said the move will particularly provide a huge relief to young Central Armed Police Force CAPF personnel like CRPF, BSF and CISF, since disability in performance of duties is generally reported in their case due to constraints of job requirement as well as hostile or difficult work environment. Dr. Singh said Narendra Modi government is making all efforts to simplify the rules and to do away with discriminatory clauses. The ultimate objective of all these new initiatives is to provide ease of living for the government servants even after they have superannuated and become pensioners or family pensioners or elder citizens. In another employee-friendly decision, the Ministry of Personnel recently did away with minimum qualifying service of 10 years for pension. Accordingly, the rule was amended to provide invalid pension at 50% of the last pay, even if the employee had not completed minimum qualifying service of 10 years. In addition to these, in yet another reform in the pension rules, a decision was also taken to amend the rule and provide pension at enhanced rate to the family of an employee who died during service before completing the requisite service of minimum 7 years. In Maharashtra, as many as 1,088 people have been traced in Ahmednagar district by the police in last month under the Operation Muskan in the district to trace missing children. District Superintendent of Police Manoj Patil said in a press conference that out of 200 cases of child abduction, 77 children have been traced. He said 47 out-of-record children were also found in Ahmednagar city and district. Patil said police have also traced 621 women and 390 men out of a total of 1,210 women and 1,091 men reported to have gone missing. Union Minister Prakash Javadekar has said a U.S. data firm tracking the approval ratings of world leaders has put the approval for Prime Minister Narendra Modi at a high of 55%. Addressing media in Delhi this afternoon, Mr. Javadekar called Prime Minister Modi a visionary leader. He said the Prime Minister has a definite vision for the development of the country. Rashtrapati Bhavan Museum Complex, which was closed for public viewing due to COVID-19 since 13th of March last year, will reopen from 5th of January. It will open on all days except on Mondays and government holidays. Visitors can book their slots online by visiting websites presidentofIndia.nic.in or rashtrapatisachivalaya.gov.in or rbmuseum.gov.in. A nominal registration charges of 50 rupees per visitor will be levied as earlier. On-the-spot booking facility, which was previously available, is temporarily suspended. In order to maintain the social distancing norms,
4 pre-booked time slots have been fixed between 9:30 a.m. to 11 a.m., 11:30 a.m. to 1 p.m., 1:30 p.m. to 3 p.m. and 3:30 p.m. to 5 p.m. with a maximum limit of 25 visitors per slot. During the tour, visitors have to follow COVID protocols.
In our special series Year-Ender 2020, today we bring you a report on Ek Bharat, Shresht Bharat. After coming to power in 2014, Narendra Modi government has given a special focus on strengthening unity and integrity of the country. The initiative Ek Bharat, Shresht Bharat was announced by the Prime Minister on the 31st of October 2015 on the occasion of the 140th birth anniversary of Sardar Vallabhbhai Patel. Speaking at an event, Prime Minister Modi had said that India's unparalleled diversity is our pride.
विविधताओं से भरा देश है. हमारा निरंतर प्रयास होना चाहिए एकता को बढ़ाने वाली चीजों को बल कैसे मिले, इन विविधताओं के साथ अपनापन कैसे बने. एक ही देश में रहने के बाद भी हमें अज्ञान होता है अपने ही देश के विषय में. इसलिए राज्यों से कहा गया एक राज्य दूसरे राज्य के साथ एमओयू करे, पैर बनाए. अब जैसे तमिलनाडु, तमिल भाषा भारत के रिचनेस को ताकत देने वाली तमिल भाषा है, लेकिन हमारा कोई परिचय ही नहीं है. क्यों न हमारा कोई राज्य 1 साल के लिए तमिल का 8 साल का एमओयू करे, हमारे उस राज्य के बच्चे 5 तमिल गीत सीखें, एक आध बार तमिल फिल्म फेस्टिवल उस राज्य में हो. भारत के इतने राज्य हैं, एक राज्य दूसरे राज्य से, जिसको जो राज्य ठीक लगे, जैसे हरियाणा ने तेलंगाना के साथ किया है, गुजरात ने शायद छत्तीसगढ़ के साथ किया हुआ है, किसी ने बंगाल के साथ किया है, किसी ने आसाम के साथ किया है. इसको हम बल दें और भारत की ये जो रिचनेस है इसको हम नजरअंदाज न करें. एक भारत श्रेष्ठ भारत कार्यक्रम को बल देना चाहिए. हमारे जैसे विविधता से भरे देश में आवश्यक है.
Our correspondent has more on this story.
Through this innovative measure, the knowledge of the culture, traditions and practices of different states and UTs are leading to an enhanced understanding and bonding between the states, thereby strengthening the unity and integrity of India. Ek Bharat, Shresht Bharat program aims to enhance interaction and promote a mutual understanding between the people of different states and union territories through the concept of state and UT pairing. The states carry out activities to promote a sustained and structured cultural connect in areas of language learning, culture, traditions and music, tourism and cuisines, sports and sharing of best practices. There is no country like India, quite as diverse, multilingual and multicultural, yet bound together by the ancient bonds of shared traditions, culture and values. Such bonds are being strengthened through Ek Bharat, Shresht Bharat. With Naseem Naqvi, Anupam Mishra, AR News, Delhi.
North India is likely to get much needed respite from the biting cold as India Meteorological Department has forecast a significant rise in temperature tomorrow. IMD said temperatures are likely to increase gradually by 3 to 5 degrees Celsius in Punjab, Haryana, Chandigarh, Delhi, Western Uttar Pradesh and northern Rajasthan during the next 3 days. Delhi recorded a minimum temperature at 7 degrees Celsius today. This temperature is likely to remain during the next 2 to 3 days with the possibility of a fall of 2 to 3 degrees thereafter. Meanwhile, poor visibility was observed in the national capital after Delhi received light rain in the morning due to the impact of western disturbances. The IMD further predicted light rain with thunderstorm to occur over northwest Delhi, parts of Haryana and Uttar Pradesh today.
Now let us take a look at the weather forecast for today. The national capital will have generally cloudy sky with light rain or drizzle. The temperature will vary between 7 and 18 degrees Celsius. Mumbai will have generally cloudy sky. Temperature will vary between 23 and 32 degrees Celsius. Chennai will have generally cloudy sky. Temperature will hover between 25 and 30 degrees. Kolkata will observe minimum temperature of 14 degrees Celsius and a maximum of 26 degrees. Srinagar will have generally cloudy sky. Temperature will hover between -6 degrees Celsius and 8 degrees. In Jammu, the minimum temperature was 5 degrees Celsius while maximum will be 17. Leh will have mainly clear sky. Gilgit will have mainly clear sky becoming partly cloudy towards afternoon or evening. Muzaffarabad will have mainly clear sky becoming partly cloudy towards afternoon or evening.
And now before we end the bulletin, the headlines once again. Prime Minister Narendra Modi says today's startups are the multinational companies of tomorrow. Health Minister Harshvardhan says COVID-19 vaccine will be given free across the country. Nationwide dry run for COVID-19 vaccination underway. National COVID-19 recovery rate improves to 96.12%. and centre extends disability compensation to all serving employees if they get disabled in line of duty. And with that, we end the midday news.